Urine Specimen Collection 2. Instant Result. This section shows you how to collect a urine specimen using a cup that enables the collection officer to carry out a preliminary test on the specimen. These tests are known as Point of Collection Tests, or POCT. The test uses immunoassay technology, the same as the first screening test in the lab. This test is good at saying nothing is present, but does not tell us exactly what is present if the result is not negative. We use the expression not negative deliberately, as the specimen needs further analysis in the laboratory, after which it may be reported as negative. The cup is designed so that only a small portion of the urine collected is transferred to the test area, leaving the remainder of the specimen available to be bottled up as you have done in the standard procedures already described. The specimen is transferred using the plastic key in the lid of each cup. All you are doing in this procedure is using the test cup instead of the usual foiled cap collection cup, but you still need the standard kit in case you need to send the sample to the laboratory for testing. The site preparation is the same as for Urine Specimen Collection 1, standard back-to-lab urine collections. Getting ready. For each individual collection, you need your collection checklist, donor information sheet and medication questions, POCT cups and standard collection kits, and chain of custody form, plus any additional paperwork required by the customer. Always greet the donor with a smile. Introduce yourself and show the donor your ID card. Then ask them to provide you with a copy of their own ID. Ask the donor to read the donor information sheet and then explain the use of the checklist. The donor must follow the checklist with you, so talk them through it, continually referring to the numbered steps, explaining what you are doing at each point. This will take you through the whole process in a logical way and will minimize the possibility of you making mistakes. Specimen collection. Invite the donor to select a POCT cup. Before the cup is removed from its outer packaging, you must note the lot number and expiry date in the appropriate place on the form. No POCT cup should be used after its expiry date. The POCT cup is removed from the packaging and the plastic key is safeguarded. The donor provides the specimen in the cup, replacing the lid. The collecting officer checks that there is sufficient urine, at least 40 milliliters, that the temperature has registered, and inspects the specimen for any visible signs of tampering. If all is okay, place the POCT cup on a flat surface and push the plastic key into the socket of the cup to begin the test. Note the time on the form. After 5 minutes, and no longer than 10, peel back the label and read the results. Your special instructions for the customer will tell you whether the donor should be present or not at this point, and whether or not you should show the results to the donor. For a negative result, a coloured line must appear at the C, control point, and all T, drug lines, points on the cup. If no line appears at the C point, then the test is invalid. If no line appears at any of the T points on the cup, then the specimens require laboratory analysis. If any line is missing, then the result is not negative, and you carry on with the procedures for sending the specimen to the laboratory. Follow your checklist. This has been designed to take you through the steps, linking the instant test with the laboratory analysis. Specimen validity tests. For some customers, we will ask you to use POCT cups with integrated specimen validity tests, SVTS. A colour chart is supplied with the kit, and the collecting officer uses this to determine if the specimen provided has been adulterated or tampered with. The SVTs include creatinine, pH, specific gravity, and oxidants. Any non-negative results relating to SVTs will be sent to the laboratory for analysis.